TMJ stands for the temporomandibular joint, which is the anatomical position of how the upper and lower jaw come together right in front of the ear. It's the most upper joint in the body. It controls how our teeth fit together, how we chew, balance between, our head and our neck and our shoulders and on down. I was lucky when I was in dental school to, tag along with my dad to, when he was doing TMJ training, and my eyes were open to, all of this stuff. So for 15 years, we've been, focusing on helping to treat the TMJ, and what I've learned is that, when people talk about that, it's almost like a black hole. Like, we didn't learn much about it in dental school. Physicians don't learn much about it in, medical school. It's like the only part of the body an orthopedic surgeon doesn't work on, for joints. And so it's like, who handles this? And, a majority, of Americans, suffer from some form of jaw discomfort or jaw pain, throughout their lifetime. It could be in any form. And maybe they have pain or they don't have pain. Their jaw could click. Maybe it pops, or maybe it gets stuck or locked open, or they have muscle pain in their jaw, or they can't chew food, or there's instability with how the teeth fit together. There are a lot of reasons why it can happen, outside of just having an accident or, getting, hit in the face with a soccer ball and the jaw pops out. Most of these things, are most of the time we have TMJ or jaw issues, the body is predisposed to it. And what I mean by that is, as modern humans, our upper jaw and our lower jaw are not growing as big or as healthy as they used to, that our ancestors used to have. So when this happens, if the jaw's not growing properly, it can affect how the teeth fit together, it can affect how we breathe, it affects how the jaw joints fit together. And when that happens, over time, our bodies are amazing as humans. We can compensate for all types of dysfunction, and we can compensate for not being healthy. Like, at very few times are all of us 100% healthy, but our bodies fight through it. And so it's why people say, for 20 years, 30 years, however long, I've had a little bit of jaw issues, but then all of a sudden one thing happened, and now it's really painful. I can't get my jaw healthy again, or for it to stop popping or the pain to go down. It's because the body's lost that compensation mechanism. Whether you opened too big to take a bite of something, or you yawned really wide, or, maybe you had some dental work done or some orthodontic work, and now, your jaw issues are starting to flare up. So, we know that it can be a chronic, debilitating thing. And so my goal for everybody is, when we do our 3D jaw diagnosis and we evaluate the health of the whole system, we want to put the pieces back together. We can make, dental appliances, or, these orthotics that I call them, that, can help people. And sometimes it's just managing treatment. We always have a choice of just, hey, you just want to manage the problem, you can do that. But, more often than not, we can go in and let's find the root cause and let's fix the reason, why your jaw joint's breaking down. And the first step is always, we have to skeletally, put the jaw back in alignment. So we can mechanically, if we think from an engineer standpoint, we can use an orthotic or a bite guard or a splint, there's a lot of names for them, that goes in the mouth on the upper jaw. The upper jaw is stable and balanced. The lower jaw is the one that moves forward and side to side. So if we use the upper jaw to balance the lower jaw that's out of alignment, then we can get the lower jaw back in place. We can diminish ear issues, discomfort, the clicking, popping, and the pain. So orthopedically, we're gaining that stability. And then, when we have that stability, then we can go in and fix how the teeth fit together to provide long-term stability. So, it may be just a one-step process for some people where, you go through treatment for a period of time and get the jaw, realigned and to feel comfortable. And then, for some people, that is maybe just the first step. And then you can go on to doing a second step, whether it's orthodontics or jaw surgery, or what we call like a biorejuvenation, by adding synthetic tooth-colored enamel that's biocompatible with your body and your teeth, and bonding it back to short teeth or worn teeth or uneven teeth to now balance the bite. So we've balanced the skeleton at the same time in providing long-term health. So there are choices when it comes to the TMJ treatment, and it's first doing a very thorough root cause exam, finding out what's going on and going over those choices with you.